This is 2.5-year-old greyhound. Low-grade hock pain been going on for 6 weeks, 8 weeks? 8 weeks. It's been x-rayed. It's showing that the central tarsal bone is actually pulled caudally. Now I'm going to show you the examination for this. When you stand and visualise, have a look at this dog initially, it's very upright in the hock, very vertical forward, even more so in the right compared to the left. When I first do the hock flexion, lets me flex it up. There's very little, there's no bounce, there's lack of flexibility in that. Not a lot of pain. Might have been 8 weeks ago, but it's just very stiff. When I palpate down the front, it's over the outside T4, down the centre over the central tarsal, and over T3, down over, that's a bit sore there. And then inside down over T2 is okay. So it's painful over T3 and the top of the metatarsal 3. Now the other thing you've got to check is the plantar area. So I'm checking the calf muscles, the Achilles, the gastrocs, the muscle in between, superficial digital flexor, that's quite relaxed. And he's allowed me to extend his calf, so it's not a calf problem. But when I come to check there's the plantar ligament between the calcaneus and the joins onto the central tarsal and T4. I hold this one, I go to move and it's very, very stiff. I compare it to the other side. I can hold that and it can move like a joystick on a computer game. See how that's moving around? I come back to here. It's very stiff, won't move. And then I test the metatarsal torsion test developed by John Katakasi in South Australia. When I go to rotate this one, it's not particularly sore, but it's stiff. And when I come back this way, it's stiff and he's a bit sore on it. When I go to rotate, do this on the other leg, holding the metatarsal, I can rotate that and it bounces. When I externally rotate and internally rotate, it bounces and there's flexibility in that. Whereas this one's very, very rigid. So I'm going to be injecting just below the calcaneus into the area of the plantar ligaments and some local and some short-acting cortisone, and then we'll check it again after I've done that. Now this is starting with the x-ray of Jack, the dog we've just examined. We looked at his central tarsal bone here. This is the talus. The dog is sore here on T3, and the calcaneus is the bone you manipulate to test for the plantar ligaments, which run from here onto the back of central tarsal and onto the back of T4, which is here. Notice with this dog, the central tarsal bone is not lined up fully at the front, it's pulled back. So this is contraction of the plantar ligaments, and when they're contracted, pain results down here. So I've just injected, let's move back to Jack. I've just injected the plantar ligaments here, between the calcaneus and the central tarsal. The plantar process is there, so I've come in from the lateral side. We can now mobilise that calcaneus, and we can now twist again. When I go to check flexion on this dog now, of the hock, I can flex it up and there's now some bounces restored. So the plantar ligament has now got some movement. When I palpate down the front, where it was painful before, below the central tarsal and the T3, the pain has gone away. That's because the central tarsal bone is allowed to come forward again, and that takes the stress of the joint capsule going on to T3. So this dog will be strapped to run, but he'll be okay to run in 7 days.